Welcome and thank you for joining us for today's webinar, 2022 Coding Changes, New Opportunities for Better Outcomes and More Income. Brought to you by integrativepractitioner.com and sponsored by HealCommunity. I have a few housekeeping notes to go over before we officially get started. If you have any technical questions or issues using the webinar platform, please use the chat box and I will respond right away. If you have any issues with the audio, please make sure your computer speakers are on and the volume is up, and also check your internet connection. Otherwise, you can call in by clicking the phone icon above the chat window to receive the teleconference information. To ensure call quality for those that do need to call in, everyone's lines have been muted. We do encourage you to ask questions throughout the webinar. Please type your questions into the chat box and hit send to submit them. Please note we will take questions at the end of the webinar today. If we're not able to get to all questions, we'll make sure to get them over to the sponsor for a prompt follow-up. Finally, this webinar will be recorded and you'll receive a thank you email with the on-demand materials within 2 business days. This will include a link to today's live webinar as a recording so you can play it back as needed, as well as a PDF of the presentation today. So again, please look for those on-demand materials sent via email within the next 2 business days. And I would like to welcome our speakers for today. We have Sonda Kunze, founder of Coding Advantage, as well as James Maskell, founder of Functional Forum, Evolution of Medicine, and co-founder and CEO of HealCommunity. And at this time, I would like to welcome our speakers.
Hello, everyone, and welcome. Great to be here and excited to share with you all today. I guess I just wanted to start by saying, I want to thank Integrated Practitioner. A lot of my education in sort of understanding the integrative and functional medicine space came from going to the Integrated Health Symposium every year from 2009 to 2019 when I lived in New York, and would come back every year. And so it's really exciting to be here to connect with you all here today. Just, one thing as a sort of a context is that, I spent essentially, I was a speaker there in 2015 and 2016 and 2017. I spent essentially the last 10 years trying to convince doctors and practitioners to move away from insurance, because ultimately it felt at that time that it was not the strongest foundation to be an entrepreneur and to build the practices of the future. Ultimately, what I'm here to do today is to share with you, some of the ways in which insurance coding changed in 2021 and 2022, and why I feel that that is actually an incredible opportunity to bring functional integrated medicine into the payer system and actually, connect with and create access for everyone in America to have access to functional integrated medicine. And I know for many doctors that I've met over the last 16 years, the desire to really help everyone and not just those that can afford it is like deep within their soul connection. But ultimately, I know that it's given a lot of people PTSD. And so what I'm excited about here today is to, share with you some of the changes that happened in 2021, some of the coming changes in 2022, and how you as a practice can take advantage of it. Now, this is a fit for doctors who bill insurance. This is a fit for groups. This is a fit for hospitals and systems. There's really, as long as you're billing insurance and you have billable providers, what we're going to talk about today is super relevant. Now, just as a follow-up to that, my knowledge of insurance billing is limited because up until about 2 years ago, I was not really interested in it at all because of what I just mentioned. And so I'm super excited to have here with me Sonda Kunze. And over the last year that I've got to know Sonda, I see that she is one of the leaders in the field as it relates to understanding coding and regulations. And through her organization, Coding Advantage is consulting organizations of all sizes and varieties who are looking to, understand how to deliver care and to use the codes to their advantage. And she's been extremely helpful for us. And so if you're watching this and you need an expert to help you with the unique aspects of billing insurance inside your practice, I highly recommend it. And you can go to codingadvantage.com to connect with Sonda. So this is kind of what we're going to do today in the next hour. And I would, highly recommend putting in questions. We'll get some questions at the end. We're going to cover quite a lot of ground. We're going to get into the meat straight away. So first, I'm going to ask Sonda to share a little bit about the 2021 changes and what opportunities that created for delivering, integrative and functional medicine on insurance. Then we're going to talk about virtual groups and how they can complement the kind of care that you're delivering, whether you're predominantly doing, drug-based therapies, whether you're predominantly doing integrated medicine. Virtual groups is a key part of the future of medicine as we see it. And so we'll be talking about that. Then we'll just be talking about how you execute that and what it means to execute virtual groups. And then at the end, we're going to be talking about preparing for an expansive 2022, because the changes that are coming in 2022 are significant as well and will make it even more accessible. So Sonda, welcome. Great to have you here and excited for you to share. So why don't we just start by talking a little bit about 2021 and what changed and why it changed, and what are some of the sort of big categories that you see have opened up into coding that did not exist before?
Yeah, thank you, James, for having me, and I'm super excited to talk about this. Always am. I'm like a coding geek, but I'll try to bring it down to making it really interesting for the providers. And that is what we've seen, the trend. And I think this really started back in 2019, but we are definitely seeing it take off at a more fast pace in 2021 and now in 2022 is proving also to be to bring around codes that are following suit. So, I mean, we're talking about services that are performed outside of the traditional office setting. That is the big thing here that has been, like you said, the insurance world has taken a shift where normally we would have, even myself working with concierge and functional medicine providers might have said, you might do better in a cash basis. We're definitely coming around and saying, wow, we're seeing the insurance industry really just stop and say, we have to rethink how healthcare is delivered. And they're starting to jump aboard, and they're doing so and proving it by having these procedure codes get put into the system, like these virtual check-ins and e-visits and telehealth and everything that we're going to talk about. The one category 3 we'll touch on health coaching, the E&Ms, which is the lifeblood of most providers. Even specialists have to see patients, and those are evaluation and management codes. And the things that have changed in 2021, which is what we're here talking about, has had a significant impact, especially to the integrative type of provider in functional medicine. The prolonged service, and then this opportunity for the group that we've been, you and I have been doing sort of together and having that leveraged and reimbursed for that matter. So I think it's really great. We're definitely seeing these things come out of the traditional office setting. And certainly we can say that the pandemic did bring around a lot of this acceptance. I think certainly that the industry was on trend to make the changes, and when the pandemic happened, it forced the changes into play, and then the acceptance in the insurance industry. So let's just tap on a few of them. We obviously don't have a whole day or to go into everything, but there's things like this virtual check-in. So this is literally unheard of in terms of insurance industry prior to the 2021 or in the let's say 2019, 2020 time period. This is like a brief check-in with your patient, which can be a portal, it can be email, it can be pretty much anything, obviously needing to be secure and following all those great HIPAA guidelines. We're not going to talk specifics about that, but certainly in terms of being reimbursed for such a thing, for 5 to 10 minutes of a medical discussion with your patient, that's something that you sort of just did inherently, talking to people. Now, we're not talking about like doing follow-up when you have lab tests and things like that. That's part of, seeing them. But if you're just checking in, or the patient needs to check in with you about something, we now have insurance on board and a code that covers that sort of thing where we didn't have before. And then we have this really unique thing, obviously, with iPhones and the evolution of those, where we can actually have patients submit images or a video to their provider. The provider can get that, do an evaluation, decide what needs to be done based on this, acute problem going on or something the patient wanted to show or talk about, and actually get reimbursed for that as well. So it's this communication piece where we're using technology where we didn't before. The patient had to show up in the office in person. Now we can actually submit an image or a video, have the provider do the evaluation, and have that paid for. So in that case, on this particular one, when we talk about that it's providers who can bill evaluation and management services, you'll see a lot of that, I want to say, language a lot in CPT. Those of you who take a look at codes and think about that, where they say physician or other qualified healthcare professional, and you just have to be careful with that. For anything that's in the E&M, or we say is a provider who can bill E&M services, those are the ones that can do these virtual check-ins and things like that. Okay, but then there is also online digital E&M services. So these were designed to say, maybe the patient put something in the patient portal, and you referred to it, read what the problem was, evaluated it. Maybe you needed to do some intervening. So you do some evaluation and management piece of that, and then respond to your patient. In this case, the way that these are written, again, it's online, it's digital, doesn't necessarily have to be one way or the other. It's up to 7 days. So the reason for that is they're saying that you could have a couple of touch points within that 7-day time period, and they didn't want the code to be continuously built, and that's why they put it in a 7-day period. So you may end up with more than 21 minutes should something be going on with a patient. Again, I think the really big takeaway with this is we're not even talking about bringing them in the office. We're talking about these digital touch points that we can have with our patients. And I think when you think about it, this is starting the turn of the old traditional way of doing medicine to opening up the availability of digital technology and how to serve our patients a little bit better. So I definitely think these are great things that are coming about. Health coaching, one of my favorite subjects, right? So it's a proven fact that having a health coach involved, and I'm sure that James is going to get into this, is really essential in showing that we can have changes, behavioral health changes in a matter of lifestyle, the way you eat, their fitness, and things like that, that have a direct relationship to chronic care management. So what we're seeing here is category 3. And I just want to quickly explain that. Don't want to get too deep. Everybody gets tired or bored when I start talking about codes. But category 3 means we recognize this as an up-and-coming technology or service provided, but we're not ready to give it a CPT code yet. They're sort of like we'll call testing the waters. In other words, they say, we're recognizing it, and if this works out, we're going to create a CPT code that may work out to reimbursement, which I believe we're going to see in the next, I'd say, 2 to 3 years. So these codes came out for a face-to-face with the patient from a health coach, and the only requirement was a certification. They have 2 national boards that they refer to in CPT language, and as long as the health coach is part of those, certified by those boards, then these codes are able to be used and billed for. So we have some individual, we have some group, but it's, again, fantastic to see that they're recognizing the shift in, who can take care of the patient. This is the #1 thing we're talking about in 2021. Again, like I said before, E&M, or evaluation management, or office visits, just cross all specialties. Everyone needs to do them in terms of the way they're seeing patients. And now those codes are also available virtually, which is how we're going to talk about how they came into the group part of it. But in 2021, they had a major change, right? Prior to 2021, there were all kinds of things that had to be in documentation that were more laborious than they were important clinically. We were counting things like, did you have 4 of these and 10 of those? And it was just getting to be, very difficult to get through and find the clinical information because we shifted the way we documented in EMRs and on paper to meet those guidelines versus coming through clinically. Now we have, you come through clinically and you don't necessarily need as much documentation. You need good clinical documentation, don't get me wrong, but it's a lot less. So less is more in this case, and we have 2 ways of doing that, right? We have time. So now the allowing of time is a major factor in selecting the E&M code. Before, time was only allowed to be selected based on certain criteria. Now we don't have any criteria. It's time, and they actually have expanded that to say what our time can be, or it's medical decision making, which is the driver to the code. And when we get to those virtual groups, I'll explain how leveraging medical decision making makes this work, and it's able to be, you're able to lift this type of thing off the ground when you learn, oh yeah, I do have patients like that, and I could document that information. It isn't that difficult. You just, again, like we were saying, the execution is the most important part of it. So in the time factor, and I think keep it, that's good. So time as a component is the time that happens on that day of the encounter. And why is this important? It's because they're allowing more than just the face-to-face. Then we have time, maybe we look at the documentation or lab tests or ER records or whatever we have prior to seeing them. Then we have the time that we're with the patient, and then we can even have time after, as long as it happens on the same day the encounter, for documenting and doing things like that in the medical record. So it's both face-to-face time and non-face-to-face time. So if we have any providers on the line, you know that is a major shift in the way that we look at time and we look at an encounter. That non-face-to-face now is able to be counted in the evaluation management. So if we pop it one more, I think we're our little list. Yeah. So here's the actual list at the AMA. This is where we took this from. And the way I've been training is preparation to see the patient, looking at history or obtaining the history, obviously doing an evaluation of the patient, any type of counseling that you need to do same day with the patient, the family, a caregiver. You're busy, maybe you're ordering medications or certain types of tests. You may even be talking to other healthcare professionals on the same day. And that next bullet is the number one that really should be a jaw dropper, is the time it takes you to document is allowed to be counted in the overall time for selecting the evaluation and management code. So that is that driver to, wow, we've had some big changes in 2021 that are, I believe, in the favor of the provider in terms of the work that you do that may not have been recognized prior to 2021.
And I think this is the one major reason why people in functional integrated medicine, they could maybe scrape by and deliver functional medicine or integrated medicine on insurance before, but the documentation time, because it wasn't billed, just wasn't billable time. And so then it just made it impossible. And I've heard that story 1,000 times in 10 years, that was what made it impossible. And so when we're talking about like one-on-one care for physician to patient or nurse practitioner to patient or PA to patient, this now, opens up on the one-on-one care, significant opportunities.
Yes. Yeah. And so what this particular slide here is just to show that when we also had that change in 2021, they changed the total times. So it used to be when you were looking at the code and you were allowed to select by time based on some criteria you had to meet, you had a typical time, which meant if you got close to 45, then you could use this code. And it was sort of a gray area. Where now it is very clear to say, if you have 45 to 59 minutes, let's say in the example in the total, and the top one is a new patient, that would be a 99204. And remember, we don't have to hit any specific element criteria of saying 50% or more of my time was spent in counseling. All we're saying is on that day, that encounter, everything I've done in terms of seeing the patient, and post-work on that particular patient might have been a total of 60 minutes, let's say, and that actually meets the documentation requirements for a 205, which is the highest level of new patient visit. Same when we look at the bottom, you can see where I have in red, those are particular because those are what we call the very traditional typical codes, right? A 99213 and 214. For those of you who don't know, we always say level 3 and level 4, and we bounce between those two in the traditional medical world of is this a 3 or a 4? A lot of you who are looking at that might know what I mean by that, but they did significantly change the times on those, and that's why they're in red. We need a minimum of 20 minutes to do a 213, and then again for 214 is 30. For integrative functional medicine, this really isn't a hard lift. You're spending time with these patients. That's the crux of the whole ways that you take care of these patients. So I think that this is really a great thing that came about in 2021. Not only did we have a change in time, but we also had a change in our prolonged services. So prior to 2021, we had this code out there that you could add to an evaluation and management, but the minimum amount of time was 31 minutes in order to even bill. The actual verbiage of the CPT said anything less than 31 minutes, you couldn't bill for your time. Now we have this prolonged service that got added in 2021 that says each time you reach 15 more minutes than those minutes we showed you on the last slide, every time you're allowed to bill the 99417 code in addition to your E&M. So for those patients that span beyond the typical time on that evaluation and management, you can count and bill for 15 minutes, each 15 minutes of that 99417. So this is going to be a really great discussion we have today, and that's billing for virtual visits in a group setting. So I think why we're bringing this forward is that this is something we've been doing, and it is something that since the changes came about in 2021 is, number one, obviously great for the patient, and that's what James is going to talk about. But number two, billable, right? So that's the important part, and that's where I come in. Is how do we do something like this and be reimbursed from insurance and it be compliant and everybody's comfortable with that. So in general, you, in our little bullet points here, you leverage something like Zoom, right? Where you have your group of people on with your health coach, let's say, for example. They're getting education from the health coach. They have opportunity to ask questions in a group setting where they have a community of people that have maybe the same problem going on. And the provider, let's say it's a physician or a nurse practitioner, has each patient come out in a breakout session with them away from the group, talk about them, their problem or their condition, everything that's going on one-on-one, and that's where we get our E&M. Okay, that's where we get our E&M code. And then as that patient is done with the physician, they get the opportunity to be back with the group and in with the health coach, learning and having that education. So each patient that breaks out with the provider gives that provider an opportunity to bill an evaluation and management code. This is where I'm going to have my, as quick as I can, conversation about, we just learned how to leverage time, and that's super important. But in this case, this is where you would leverage the medical decision making. Remember what we said is the one big change that came around in 2021 was we could either code and document by time, or we can code and document by medical decision making. I'm just going to use an example, right? You can't cover every possible scenario, but in an example where we might have diabetes and hypertension together, and that's what our group is meeting about. That's what they're with the health coach talking. And they come out into the breakout room with the provider, and you're seeing them one-on-one, and you're dealing with their diabetes and their hypertension, and maybe they're still on medications for those. For example, this is just an example. Those are two chronic conditions with medication management that, regardless of the amount of time spent, documented appropriately, actually qualifies for a 99214, even if that is 5 to 7 minute touch point with your patient. probably wouldn't believe it, or you might if you think about traditional medicine. And the average time is 7 minutes per patient for an actual office visit if they come into the office where they're actually seeing the provider. But in this case, what we're doing is giving them the opportunity to be with a health coach and learning and getting the education piece there. And then we're having that one-on-one with the provider. We're truly addressing the problems like we would do in the office. We're managing them, and we're going to document by medical decision making. So I give that example because let's say the patient is not on medication. There are other things that come into play with the medical decision making that we can still get a level for, but if we just remove that and just talk generality, it might be a 99213. So again, those are things that we're talking about in billing virtual group sessions. We don't necessarily bill for the health coaching time. We're billing for the one-on-one. James, do you want to add anything to that?
Yeah, well, just, I think that this is where I want to take the conversation now, because, we've learned this over the years. And ultimately what I want to share with all of you now is that, like, am of the opinion that group medicine is absolutely critical to actually getting patients to participate in their care, which is critical for integrative and functional medicine. And now that there's a structure where it can be billed to insurance and can be very profitable for the clinic to deliver because of the sort of billing 20 people for the same amount of time model, means that now, where once integrated medicine was sort of kicked out of hospital settings because it wasn't profitable enough compared to putting in heart stents, we now have an opportunity where we can sort of compete with the profitability of conventional medicine. And that means that integrated medicine can find its way into more interesting places. I think all of us understand really the scope of the problem in the world right now, in America right now, and why we have the worst health outcomes and why we have the worst outcomes with COVID. Most people just trend towards chronic disease because there's no education on how to stay healthy. They have poor health habits and they have very little time with the doctor. What we've created now at HealCommunity is a way that we can partner with you to essentially deliver this virtual group care model, and have it on insurance and it to be profitable for both clinic and for HealCommunity. So ultimately what we do is, the doctor can prescribe it. They can join a supportive community. We deliver this missing curriculum and we see significant health improvements and reverse chronic illness. So, if you've been following me for the last little while, or if you haven't, you know that I'm really passionate about group delivered medicine. And that's essentially because chronic disease is biopsychosocial in nature. We needed a pandemic to really realize this for ourselves. And how many of your patients are lonely and are having worse health outcomes because of that loneliness? Not just the loneliness factor, but also the structures that they had before of friendships that helped them, facilitate healthy behaviors were destroyed. And I guess I've said many times that you can't solve a biopsychosocial disease with a purely biological intervention. And that's why we believe that delivering a biopsychosocial intervention is truly transformational. And you don't need to look very far to see that, loneliness is the biggest driver of all-cause mortality, more than smoking, more than physical inactivity, and more than alcohol. And yet think about how much public health efforts are spent in dealing with those kind of issues. And if we don't get to the socioeconomic factors of health, then we really can't deal with the whole person, and we can't help everyone get well. Another thing that we've seen, I've helped practitioners build like scalable education systems for their patients and for their prospective patients for years. But what we've also found is that information by itself doesn't move the needle on health. You need this combination of mentorship, accountability, and support to consistently motivate change. And that really is an understanding that we've come to from just seeing group medicine happen, where now people have, they know someone else now who's overcome the condition that they've overcome. And we've seen how critical that is to having people kind of maintain the healthy behaviors. And I really don't think it's good enough now to say, well, look, this patient didn't do what I told them, when you gave them the most ridiculously complicated, functional medicine protocol, and then sort of putting the blame on the patient as though, well, they should be able to do it. When you're asking people to make significant changes in their lifestyle that they've been doing for a long time and have significant habits, and do all the supplements and labs and other things, that's a heavy lift. And so we need to create structures that are proven to do that. This is a diagram that I created after, more than 10 years in the space, and really just showcases that, if we get people early on, if people do the supplements and follow the program, they will get better. And you can see that here with the red line. But ultimately, if people don't do the lifestyle changes, if they don't change the way they sleep and the way they eat and the way they deal with their stress and their community, typically their health can sort of like go up a bit and down a bit, depending on how like focused they are on the health in that moment. Whereas if you can really inspire people to long-term lifestyle changes, where they change completely the way they work. And just think about this for a moment. I'm sure you can all think about patients that you've had where they just went all in and changed their habits forever. And, they couldn't help but be way healthier. And the question I guess I want to ask all practitioners is, when someone comes to you and has an episode of care with you in your integrative or functional practice, what does their health look like in 5 years? Now, ultimately, the answer is, I have no idea, because in the clinics the way that we've been doing business, where we've just been doing fee for service, you have no idea. But as we move into value-based care, that question is going to be critical. And my belief is that integrative and functional medicine is perfectly positioned to take advantage of shifts towards value-based care. But we need to know where patients are in 5 years, because if we're keeping them healthy, that's how you make money in value-based care, by reducing the cost of care. And so ultimately, this is mission critical if we're going to scale in this next era. And ultimately, what I've also seen is that if you look at people's health along the bottom axis, that there's two types of people that have made their way into functional integrated medicine offices. The sort of severely chronically ill here you see on the left, right? People who are older, are desperate, and have multiple chronic illnesses. Or you have the sort of worried well, the people who are, healthy, educated, have access, and are empowered. But ultimately, it's this middle group, right? The people who are a little bit chronically ill, pre-diabetic, pre-autoimmune, pre-heart disease. They may be taking some medications. Some of them may be empowered, some of them may be disempowered, but in general, they find behavior change hard. They may be isolated, and they probably have habits that revolve around the most unhealthy things, which is the majority of American habits. If you think about the things that you do in community, tailgating or pizza and beer night, oftentimes these are like unhealthy habits reinforced by community. And if you want to reverse a chronic disease, you need to build new habits reinforced by community. And that's the opportunity for groups. So I'm so passionate about this. I wrote a book about it. It's called The Community Cure. If you haven't read it yet, and if you're like me and your ears have more free time than your eyes, I'm going to give you this opportunity now. If you can download it for free, you can listen to it on audiobook. If you go to thecommunitycure.com/audiobook, you can download that book, you can listen to it. And, in that book, the first half is really convincing you that integrative and functional medicine delivered in groups is the model by which this care will scale to everyone. And then the second half gives you a step-by-step guide to running groups. And this all started with, Dr. Shilpa Saxena, and you may have seen this diagram before. She's an incredible lecturer. And it's interesting, if you look here on the right, and that she created this in 2012-13, what's happening in this group model is that the physician is taking people out of the group for a minute in order to do the things that are necessary for billing. And that's exactly what Sonda just described, except we're now doing it in a virtual setting so that we can facilitate this kind of traction, but in a virtual structure. Now, you may have heard of the Cleveland Clinic Center for Functional Medicine. I first heard about this data from Dr. Hyman at the 2019 Integrative Health Symposium. But essentially, over the last 7 years at the Cleveland Clinic, they first showed that functional medicine outperformed conventional medicine, which is the one on the left, and this was in JAMA. And then on the right, this came out early this year, that not only are patient outcomes better in group medicine, but the cost is way lower too. And if we want to get functional medicine and integrated medicine into systems, it needs to, operate on a better cost structure and a better profitability structure. And that's why groups are so powerful. And this is just a little bit of like what happens to people when they go into groups. There's significant shift on the individual level, building of self-efficacy, regulation of emotions. Like, patients need this to heal. But ultimately, it's very difficult to do this in one-on-one care. In fact, it's probably impossible to do this in one-on-one care because ultimately you've got to teach them skills, you've got to change attitudes, there's changes in their interpersonal way that they are, and then there are shifts in the organization and the community too. So this is the power of groups. This is why I believe everyone who's got a chronic illness needs to be in a group, and now we have a structure to do it. And this is what our HealCommunity groups look like. This is the level of support that people need in order to make these changes. They need belonging, they need trust, they need a way to communicate with each other, and that's the sort of central focus. But look at all the ways in which we surround this patient to feel held while they heal, right? They have a group, they have this extended episode of care, 24 weeks. You can see I'm in the green now and I'm going sort of counterclockwise. They have a personalized plan that comes from you as the physician, and we're just helping you to execute that plan. Part of it is self-guided exploration. You have a coach. You're still connected to the team, and one of the things about groups is that when people have tried to do it, if it's not connected to your medical team, you don't have the same communication and you can't track the progress of the patient. Well, now you still are connected regularly to your doctor or to a nurse practitioner from the clinic. You have the online portal, and then the top right, this progress partner. When we started the groups, we thought we should have an accountability buddy because everyone needs accountability. But what we learned is that people actually don't want accountability, even though they need it. But when you change the language slightly and you call it a progress partner, people love it because everyone wants progress, right? And these are the outcomes that we've achieved in HealCommunity. So, and the good news about this is that these outcomes can become your outcomes. Our model is essentially that we become an extension of your care team, all delivered virtually. You prescribe the program, we execute the program, you bill the program, and then we essentially split the money, although we charged you for our services that essentially splits the money. It's not a fee split, but it essentially acts like that. And so one of the things that we've learned over the last year since I brought out my book is that logistics around groups are hard. I was on Dr. Geller's group visit conference a couple of months ago, and the number one thing that came up from providers is like, well, who's going to do all the legwork, like all the annoying details of content and team and hiring and patient experience, and where do we even have a physical space that we can do it? And so it's the non-clinical logistics that typically stand in the way. And also, like most physicians, we found, either aren't interested in running groups or know that they're not very good at it because it's a very different set of skills to hold a space as opposed to have the answer. And doctors have been experts their whole life. So what I wanted to go through just really quickly here, and then we'll get to the 2022 changes, it's just 10 things that we've learned. We've run, hundreds of groups at this point, or hundreds of sessions across multiple clinics for psychiatrists, for cardiologists, for primary care, for pain medicine, and this is some of what we've learned. First, HIPAA is critical, right? I know that in functional medicine, when people have been on insurance, people have tried to do groups with like Facebook groups and that kind of thing. That's going to be hugely problematic if you're billing insurance to do anything like that. Like HIPAA is not only critical, but you can go to jail for HIPAA violations. So you need to have a HIPAA compliant technology. We've really embraced a 2-coach strategy. One coach to really hold the container, and then another coach to essentially be there to take care of any details that come up, people having a problem logging onto Zoom, that kind of stuff, like all of the admin stuff, making sure that everyone shows up. Groups are not webinars. Doctors and even nutritionists and dietitians and other providers have a tendency to lecture. And, this is what you're listening to right now is a lecture, right? Sonda and I are talking and you're learning. That's not a group. A group is a facilitated communication where the majority of the content is being driven by the people in the group. And that's very different. And so, don't be fooled that a webinar is a group format, even if there's a Q&A, it's not. And this is what I was speaking to a minute ago. Practitioners generally are not coaches. And so what we found is that coaches are uniquely able, not uniquely, but are very good at holding this container and essentially not being experts and bringing out the expertise of the group, which is really what facilitates empowerment, which is what facilitates participation, which is why we're able to get such awesome, consistent outcomes. And even the world is waking up to the health coach. So this is, this was in the New York Times a few months ago. And I love this quote from Brene Brown, who says, "One day you will tell your story of how you overcame what you went through, and it will be someone else's survival guide." This is an amazing quote, because ultimately, if you look at Alcoholics Anonymous, what is that mentor, right? It's that someone who actually got sober. What is a health coach? It's someone who actually got themselves well, generally, right? And now wants to participate. And the fact that they got sick and got themselves better provides that mentorship role that is severely lacking in all of healthcare, not just integrative and functional medicine. But if you're going to want people to participate, you've got to give them a roadmap, and giving them a mentor can speed their shift. We found that people get as much value from each other as they do from the coach. I mentioned the progress partner. We found that less is more, right? Less content. Like every doctor that we've spoken to, who wants to do this, is that their first idea is like, well, let's teach them straight away about leaky gut and let's educate them. And ultimately what we found is people are just so overwhelmed. You just need to kind of be with people for a bit and have them really get clear as to who's going to support them in their transformation before you try and teach them a lot of stuff. The foundation is critical. Ultimately we spend a whole month at the beginning having people build trust, right? Build trust in the container, feel comfortable in sharing, doing their timeline and matrix, setting SMART goals for 6 months, really getting clear in who in their community would be effective. And ultimately what we're doing in our groups is essentially the foundations of health. These may look familiar to you because ultimately healing only happens in one way. This is how you get healthy. You do these things consistently. And so we have a whole month focused on each one of these pillars. And in that month, there are challenges, there's progress, there's content, there's meetings to really make it easy for people to become accountable to moving the needle on these areas. When you start to work outside the tech savvy community, be prepared. Our average patient at HealCommunity is 57-year-old female. And so we've had to really adjust our strategies and our technology to serve that community because they do have unique technological abilities and skills. Technology is expensive, right? For any clinic to build this themselves, we've already invested almost $1 million in this technology, and there's no way that every clinic can do that. And so technology is expensive to build, but it's also expansive. And what it means is that you can really scale the delivery of the care. And so our technology now allows, we're working with many clinics now across the country, and bigger clinics and groups and hospitals as well. And it really takes a village. And this is our team here at HealCommunity, and everyone you see there, has had a real engagement with chronic illness. Either they've been chronically ill or they treat chronic illness every day in their clinics. And so it does take a village to build something like this. And so that's what we're doing at HealCommunity. We're reversing chronic disease together. And that's the opportunities. We'd love to work with you who will be listening to this to deliver this group services as a synergistic service to whatever you're doing. The precision medicine, the functional medicine, the integrated medicine, the therapies that you use, even conventional medicine. One of the most exciting things is that we're starting to work with a lot of conventional doctors who have never taken any training in integrative and functional medicine, but recognize their patients are sick, recognize their patients are lonely, recognize their patients would get better if they just did the fundamentals of health creation. And that's really exciting to see, more patients who have never seen this kind of doctor have access to this kind of care. So there's just a bit of an overview of what we deliver in the group. I've shared with you all that, some of what Sonda was saying earlier, but it's education, it's empowerment, it's collaboration. And these are the different pillars. And so each program that we do combines 7 group sessions, one-on-one coaching calls, 4 weeks on each pillar, curated education. You get matched with your progress partner. We have challenges, community engagement. There is potential for chronic care management as well, where you could do more regular one-on-one coaching calls, but that's only for certain clinics that already bill, chronic care management codes. So I'm willing, in the next 2 weeks, I'm willing to take a call with anyone listening to this who wants to talk about their unique practice situation, see if it's a fit. I've been like a practice management consultant, I guess, for more than a decade. But if you go to healcommunity.com/IP, you can book a time in there, and I'll be happy to find out more about your practice, see if this is a fit. Ultimately, we're looking for MD, DO, nurse practitioners who can make their own decisions and who take insurance in America right now. So that's what we're doing. We're reversing chronic disease together. Now, what I'm super excited to share, definitely put in any questions about what I just shared. 2022 is opening it up even more. And that was the name of this webinar. That's what we're going to get to now. We're just going to spend 5 minutes talking about what's coming in 2022. And more excitingly, there's more opportunity to do some of this stuff and to get paid furthermore. So Sonda, why don't you share, what we're seeing in 2022 and what's coming up and what we already know.
Fantastic. So yeah, 2022 is really going to bring around some more codes, right? Some more not office traditional codes, but codes that take care of services or recognize, let's say, and reimburse services that are outside of the office. So we've had some major changes that are coming down the pike in 2022, and the big ones, right, for most practitioners they're hearing about is remote therapeutic monitoring and principal care management. So the in the remote therapeutic monitoring, I didn't mention in the beginning that we already have codes called remote patient monitoring or remote physiological monitoring. So we do have some of these vitals, physiologic measurements that we have learned in 2021, mostly lifting, doing the heavy lift of how do we do this in our office in terms of having somebody remotely monitor our patients, get that information and bill for it. So you can go forward. What's happening in 2022 is that we're adding to those codes. So just a quick overview. What's changed is we've had 405 changes to CPT, 249 new codes, always deletions, 63 of those, and 93 of them are revisions. And this all takes effect in January 1. Interestingly, and this is a pretty high amount, 43% of these changes are tied to new technology. So either category 3 or some kind of proprietary lab, but also in these, just these codes that are coming about, again, that are not traditional, not office, that are leveraging technology as the basis for getting reimbursed for patient care. So again, with COVID, we've had some really big movements in vaccines, and I'm sure you've heard all about that. Don't need to spend a whole lot of time on that, but they're really recognizing anyone who's providing these vaccinations and getting those reimbursed properly, and actually making codes specific to start measuring who gets the first one, who gets a second, anybody getting boosters, and just evaluating how that is, how treatment's going for that and how they're going to do that in the future. And so the big things I want to hit are the remote therapeutic monitoring and the principal care management. So we go to the next slide. So here are the codes for remote therapeutic monitoring. You might wonder, well, what is this? If you were aware of the remote patient monitoring or physiological monitoring, they have specific guidelines that you have to follow in terms of, for example, let's just take the glucose monitor. It has to be totally wireless. It has to speak to a software that measures the glucose in the patient, on the patient, and that it reports it all wirelessly. In other words, you're not allowed to have patient intervention with these codes that were in 2020. They were introduced in 2020 and in 2021. What we're seeing, now we don't really know the full value of this yet because we're waiting for the final proposed rule to come out to tell us a little bit more about it, but they're introducing them in the same structure. That's why I think it's going to be a little bit easier to introduce to the medical community who's doing the remote patient monitoring, who has thought about it. Now we're going to come over to these therapeutic monitoring. And although they have, it's just about the respiratory and musculoskeletal system, what they're saying about these codes is, okay, we recognize that there's going to be some patient intervention. So it's not going to have the same stipulation as remote physiological monitoring that requires it all to be wireless with no intervention from the patient. what they're coming out with is, okay, well, maybe the patient's gonna give you feedback on what's going on. And again, we don't know the full depth of these codes, and we will. I'm looking forward to hearing more about these later on in this month. But we are seeing that they're going to allow these codes to have some patient intervention in a measurement of what's going on with themselves. So I think, again, there's where we get the patient involved, actively involved in their care and their treatment and hopefully their outcome.
Yeah, and I guess I just want to share to that is like, what I see is as the biggest shift is like, it's okay to measure, right? But we want to improve. And ultimately, like what you need to improve those numbers is you need a structure for behavior change. And so with that group structure already then created and the technology stack in order to be able to take advantage of these codes, our hope is that in 2022, to be able to help our clients who are running groups, start to access some of these new codes and some of this new revenue that's very difficult to access if you're just, regular clinic trying to do new things.
I totally agree. When you're trying to leverage yourself and trying to work and kind of function on a day-to-day process and all of your resource, and it seems like such a heavy lift, that's where a group like HealCommunity can come in and make this very simple, work in tandem with you, and it's like being an extension of your own office without you having to concern yourself with all those, okay, who's going to do this and who's going to do that and how do I get it to work? And then that kind of rolls right into that principal care management. This is really exciting piece for me. In chronic care management, our traditional codes that have been out there have been, you need to have at least 2 chronic conditions in order to leverage taking care of those patients and being reimbursed for them. Now, you're taking care of them anyway, but in terms of outside the office, either your clinical staff time or your own time, you weren't reimbursed unless the person had 2 or more. Now we have this principal care, which is basically one chronic complex condition going on with the patient that now is coming around just like CCM, only it's one condition versus having the stipulation of 2. So now we have another availability to use in addition to chronic care management. It's part of the chronic care management family called principal care. So that's coming out 2022.
And my understanding is that chronic care management payment is going up by more than 50% from about $40 a month to $60 a month with some of those codes. So, there's more revenue for that, and that must mean that it's working. Like that's why they want to continue to incentivize it. And so we are able to access that kind of revenue through our program as well. So, there's an opportunity now to make sort of concierge level revenue in an insurance practice per patient. And we're helping clinics do that right now. And we'd love to talk about that. So if you are watching this, make sure to get in touch, healcommunity.com/IP. I can talk you through kind of what we know now and how to go from here. I do want to make sure, I know we had some time for some questions. We've got 7 or 8 minutes here. So let's just jump into some questions now. And if you have more questions, you can go to this website, book a time with me. You can also, obviously, you can connect with Sonda, codingadvantage.com. That would be in more of a consulting role for you to like build your own clinic. Ultimately, what we're doing at HealCommunity is partnering with clinics to deliver our virtual group services. And then, that is uniquely profitable for the clinic.
Thank you, James and Sonda. We have time for a few questions. Just a reminder to enter your questions in the chat box. And if we're not able to get to all questions, I'll make sure to forward them off to James. A question here, someone may have missed this, but are virtual group services considered category 3?
No. So virtual group, again, the virtual group session itself isn't the part that is billed, right? So when they were saying category 3, and we were saying the health coach is driving those virtual sessions, we're not actually going to bill that category 3 code, because what the practitioner is billing is for the time outside of that on the one-on-one evaluation and management. So that group session in and of itself is not category 3.
Thank you. Our next question, have you ever worked with a federally qualified health care center or other community health centers similar to Jeff Geller's previous clinic?
We haven't worked with those right now, but we are open and interested in looking at those examples. Ultimately, because Medicaid pays below Medicare, it can work, but in some cases it doesn't work. We have found that federally qualified healthcare centers, like the service, can definitely be provided. We just have to really understand the billing. Sonda, what are your thoughts on that?
Yeah, I don't do a lot of work with federally qualified healthcare groups because they have their own little, it's only like just be like being a specialist, like a cardiologist doesn't do GI work. Federally qualified healthcare, that has a lot of coding rules and regulations that have to be followed. So I don't do a lot of work with them. I'm aware of it, but again, like that space, I'm just not in.
Thank you. We have a question here. We would like to begin offering virtual group-based mind-body skills training to promote stress management. Are there any codes available for this?
I'll just jump in quickly and say, that is something that is delivered inside the HealCommunity structure. So month 3 is stress, and we're teaching mind-body skills, through the content and through the sessions. Ultimately, that is part of a structure that, is this sort of anchor program. Delivering that specifically, Sonda, you'll have to talk to that.
Yeah, absolutely. And I think this is a fantastic example where the group works. And the reason is because right now we have a lot of mental health issues in this world, and especially with, again, the pandemic coming around and creating this atmosphere that is uncertain, lonely. When you talk about are there billable codes, you have to think about this. These are patients of yours who would have anxiety, social anxieties, depression, and things like that that would be in common that you would put in this group, in this cohort together, in which the provider would still have those one-on-one sessions. Let's say maybe they are managing it at the time with medications, and they can have that kind of conversation, not necessarily on medication does it have to happen, but providers are going to see patients definitely about stress-related social anxieties, just anxiety in general. They could be suffering from all kinds of mental health, and there's a lot of reason to do that in group and then see the patient one-on-one. So it would be the same, we'd leverage it the same way we've been talking about it, but you'd use an ICD-10 code that related to their mental health issues that were going on.
Yeah, and just to follow up on that, in the book, The Community Cure, I shared obviously a lot about Jim Gordon and his work of delivering mindfulness-based stress reduction in groups, and just how ridiculously efficacious that is for, a range of conditions, especially PTSD. So yeah, I love that question, and I think we should all be thinking about ways that we can deliver that modality at scale in our communities, given the state of the pandemic.
Thank you. And for our final question, someone is asking, what are the 2 board certifications considered in health coaching?
Yeah, I usually have these honestly at the tip of my tongue, and I should have known this was going to come up. They're both national boards, and I can't remember, I can't quote them exactly, but I'm happy to give those to James so that you can either put that out there, or it's 2 specific boards that have a particular program that's acceptable. These, again, this is based on the American Medical Association's definition of a health coach and those particular category 3 codes.
Yeah, that's I can, if you want to follow up on that, feel free to, reach out to me. You can book a time. We can talk more about that. We've been hiring our coaches specifically from, a couple of programs like Functional Medicine Coaching Academy, where the board certification is like part of that path.
Yes.
I think there are other groups that, that are following that path as well. And things are definitely opening up in that world too. And the sort of the cross section of medical coding and coaching is something that is like evolving all the time, and we're sort of right on the cutting edge of that with some of our advisors to understand how to do that. So Yeah, grateful, really grateful for the opportunity to connect with you guys all today, and thank you for your time. And would welcome an opportunity to connect with you about your unique practice. And ultimately, I know that running a practice and the sort of non-clinical aspects of business development and business organization can be super overwhelming. And so, that's one of the reasons why, having been in practice management and consulting for a long time, decided to create this group, this company, because ultimately just realized that we needed to take a lot of administrative lift off of the shoulders of providers and organizers. So look forward to connecting. Thank you so much, Sonda, for being here with us today. And thank you, Integrated Practitioner, for the opportunity to connect with your community.
Thank you, James. Thank you, Sonda. We are out of time. Just a quick few housekeeping notes for the audience. Many of you have asked about the on-demand materials. Just a reminder, everyone will receive a thank you email with the recording of today's live webinar, as well as a PDF of the presentation. So again, look for that in your inbox in the next 2 business days. Also, if you could fill out the short evaluation form that will appear once you close out of the webinar window, this will help us in developing future webinars, and your feedback is greatly appreciated. Thank you again to Sonda and James for your time today and your presentation. This webinar was brought to you by integrativepractitioner.com and sponsored by HealCommunity. Thank you all, and have a great rest of your day.